Health Watch, health officials say they've identified 3 new cases of adenovirus in students at the University of Maryland. That is the same illness that caused the death of freshman Olivia Paragal. The 18-year-old died last week after complaining of flu-like symptoms.
And the adenovirus is blamed for the deaths of 11 children at a healthcare facility in New Jersey. The Wanakee Center has over 30 cases of the illness in children. For more on this illness now, we want to bring in Dr. Shoshana Ungerleider. So this is really fascinating to me. You know, we have this adenovirus. It's supposed to be a very mild virus, and we can understand why it turned deadly in New Jersey, but now something very different is happening. Why so many recent deadly cases, do you think?
Well, it's a good question. Adenoviruses are really common viruses, as you pointed out, and they can cause a wide range of not very severe illnesses, most commonly respiratory illnesses like the common cold with a sore throat and a fever, or even bronchitis, pneumonia, diarrhea, or pink eye. And they can cause this problem for people at any age. I think the reason why it's causing a deadly outbreak now is that it's being spread rapidly. So this is a virus that's in our environment. We get infected by close personal contact, such as touching or shaking hands with someone who has the virus, and it's in the air. So somebody infected, if they cough or sneeze and then touch something or touch you, and then you touch your eyes, your nose, your mouth, that's how it spreads. And I suspect that in close quarters, such as dorms where, these students are, that's how it's been spreading.
Doctor, for a lot of people, when they read about the fact that there are some parents who believe that mold in the dorm rooms of the University of Maryland may have had a connection between this virus and the death of this young freshman, could that be the case? Because it's not just the University of Maryland that's got mold. Here in New York City, a lot of apartments have mold. Is there a connection?
Well, we know that mold doesn't directly cause adenovirus. It can definitely exacerbate the respiratory conditions, such as pneumonia or bronchitis, that can be contracted as a result of adenovirus. So it definitely can't help. Does it cause adenovirus? No.
So the thing about adenovirus is that a lot of the symptoms are pretty benign. They're just sort of your average cold or flu symptoms. So how do you know that you have something more serious?
Well, I would say that if you're having significant respiratory distress, diarrhea such that you can't keep any food or drink down, definitely call your doctor and be seen. And obviously, if you're in a severe situation, call 911. We can definitely help you out at the hospital.
But here's another question, though, for you, doctor. This, for people who may be worried, you have to have a weakened immune system, right? Or is somebody who's very healthy, are they susceptible to getting this virus?
Well, like I said, it's commonly found in the environment. So it can be spread by touching, an infected surface. One tricky thing with this particular virus is it's very what we would call hardy, in that common disinfectants and cleansers don't kill it. So it lives for a long time on hard surfaces. So, what I would say is that it typically causes a pretty mild infection. Those with weakened immune systems or somebody that's taking medication that might weaken their immune system are at higher risk of having a more severe or even a fatal infection. But typically you're correct in that it causes very mild symptoms for people.
So, doctor, because we have this, young, presumably pretty healthy college student who was killed by this virus, is there a possibility that the virus is changing and is becoming deadly?
Well, at this point, we don't know. I would say that that's unlikely, but we do know that anyone with chronic medical problems like asthma or diabetes, or like I said, any illness that lowers your immune system, or if you take medicine that lowers your immune system, you're at risk for a more severe infection or even death. And my understanding was that this young college student may have had Crohn's disease, a condition where she may have had an already weakened immune system.
Yeah, I had read that perhaps she, because of her weakened
But does that weaken your immune system to that degree?
That's the question,
right.
right? Yeah. It's also really tough because you know, something like this, I think for people who are following this story, they probably only just now heard of the adenovirus. So you get something that looks like a mild symptom of the flu. It's flu season now, and you don't know that you've got this thing, and that could be, you know, we could spend a lot of time talking about this, doctor. But clearly, you know, we have a huge audience that watches this network that's very interested in this subject. So we thank you so much for shedding some light on it for us.
Thank you for having me.